Good morning, guys. My name is Regan, and I am going to be going over how to draw up a medication appropriately. Now, before we get into that, we do need to review the six patient medication rights because that is super important in giving a medication and therefore drawing up a medication. So, the first thing is that we want to make sure we have the right patient. Yes, it might seem a little silly because usually we only have the one patient in the back of the ambulance. However, there are times where we may have multiple patients and we might come across a mass cat situation. So get in the habit now of making sure you have the right patient that you're giving this medication to. We also want to make sure we have the right route. Not all medications can go and be administered to your patient in the same way. So you want to make sure we are doing that appropriately, as well as documenting the time appropriately. This can affect how you treat your patient in the future, as well as their treatment that they get in the future at the hospital. So it's very important that we make sure we get the right time. As well as those three, we also need to make sure we are getting the right medication. We're verifying that the vial we have in our hand is the vial that we want, as well as making sure we have the right dosage. Not all medications can be given the same way, can be given in a certain amount of time, nor can they have all the same doses. So make sure you verify the vial, verify what's in the vial, and then verify what dose you want to give your patient before you do anything. The last thing you want to do is you want to make sure that you are documenting appropriately. This can affect your treatment and the treatment that they are going to get in the hospital. So, all of those six are very key and very important things to double check, triple check, and have your partner check before you're giving any medications. This helps your patient and helps you in the long run. With that said, we are now going to talk about all of the items that we need to draw up a medication, so long as there are no questions. Okay, so we need, let me back up. I will preface that all of the equipment that I am using is training equipment. So they are no longer in their packages, they are no longer technically clean. If you are giving a medication, please make sure that all of the items you are using are in the packages, are clean, the packages are good, they are unexpired. Make sure that you are not giving your patient dirty items because that can lead to infection and problems for you later down the road. Now, with that said, all of this is training stuff. It's not going anywhere. It's not going on a patient. So do not mind that it's not in the package. Now, we need a blunt tip needle. So blunt tip needles will say blunt tip on the package, and it's also noted by the red at the bottom here. You'll need a syringe, an appropriate syringe that will fill all the dose that you need, as well as a hypodermic needle, depending on how you're giving your medication. And then you need your medication vial itself. Usually there is a little plastic top on this that you would pop off and that keeps this clean. Again, we do not have that here. So do not worry about that right now. With that said, having an alcohol swab would also help ensuring that this is clean in case the top has come off somehow, some way. You can just clean it with some alcohol. Now, in order to begin, we need to assemble our equipment. So you will take your syringe and you will take your blunt tip needle. The ends will meet like that, and then you will gently twist. You do not need to crank it down because then you won't be able to get this needle off later. So you can tighten it down and then give it a little loose at the end to make sure you can get it off. Now, with this, we're going to pretend that this is Zofran. This is actually just sterile water in here for training purposes. So we are going to look at our dose on the vial. We're going to see how much we want to give. We're going to say we're going to give 1 milliliter of this, so it would be 2 milligrams that we're going to give of Zofran. You want to make sure that the vial you have states the medication that you want, and then you want to look at it. You want to make sure that it's not expired. You want to make sure that the liquid inside is clear. It doesn't look cloudy. It doesn't look yellow. It looks pretty good right now. We'll do the bottom. And then you also want to make sure that there's no sediment in it. All of these would be no-goes, so you would not use this medication. You would put it down, put it away, sharps container, trash, whatever your protocol is. Once we've verified that, we have it handy. And now we can go back to our syringe and needle. Now, to uncap it, we are going to do a rainbow samurai sword. What I mean by that is you're going to grab either end and you are going to arc it. Now, put this somewhere safe and be careful when you use this, okay? This, even though it is a blunt tip needle, it does not mean that you cannot get stuck with it. It is still sharp. Now, you can or you do not have to, it is up to you. You can pull back how much you want. So we are going to do 1 milliliter. So I'm just going to pull back to the 1, and I'm going to make sure that the top of my plunger is flush with that line at the 1 cc. Once I have done that, I'm going to now hold this like a dart. I'm going to grab my medication vial with a clean top, and I'm going to also hold it like a dart, like such. I will then bring my palms together so that they are touching, and I'm going to put my pinkies together, and I'm going to insert my needle into the middle of that rubber stopper. This helps give you support while you are in the back of the ambulance, just in case you are bumping down the road. This helps give support so you can attempt to avoid an accidental needle stick. Now, once that happens, I'm going to grab the vial like this, and then I'm going to grab the syringe like this. I have positive control of both, while I'm also not touching where the needle and the rubber stopper meet. We want to, again, keep that as clean as possible. After that, I'm going to let go so you can see, I'm going to push the plunger up. This will help create a better vacuum so then the plunger can pull down. Sometimes it pulls down a little bit more than others, and then you don't have to pull down at all. We had to pull down a little bit, that's okay. Now, there are some bubbles in the bottom here, and there's a big bubble up top. So what I'm going to do to get rid of it, I'm going to pull just a little bit more medication than what I need, and then I'm going to flick the syringe to try to move those bubbles. If that ends up hurting your fingers, you can just tap this side with your regular palms on your fingers, and then that will work. Now, again, we drew back a little bit more medication than what we need, so we are going to push back the plunger to get rid of that air bubble up at the top and to get what we need. If you accidentally overshoot, that's okay. Your needle is still in, so you can just pull back a little bit and get what you need. Okay, now I have verified that I have 1 cc's in here. So what I'm going to do, that's what I want, that's my dose that I want. We'll verify that that's what we want. We are going to put it on its side. And now we're going to rainbow samurai sword again. This vial will go away. And again, we do not want to touch this needle. We don't want to recap, because if we recap this needle, we run the risk of an accidental needle stick. We want to keep ourselves safe, so we won't be touching it. Instead, we will twist gently off, and this now will go into the sharps. Now, if you have an IV, you have an IO already, you clean that space and you can give this medication right then and there. If you are giving this IV, or my apologies, IM or sub-Q, or however you're going to give it, you can then grab your needle that you had earlier, again, in the packaging. You get it out of the packaging so it's clean. And then you once again make the ends meet, twist it. And now your medication is ready to go. If you need to put it down for whatever reason, you can put it down, and the tip of this is clean, and you're lowering the risk of infection. Make sure that you have everything you need in order to give that medication, but that is how we draw up a medication. All right, are there any questions about anything that we went over?
I was just wondering about the 5 patient rights and what those are. So I know there's right person, right time, right route, right dose. I just can't remember the other one.
So you're so close. There's 6. So you had patient, time, route. What was the other one you said? Dose. Okay. We're drawing up what?
Medication.
Medication. Okay, so that's our 5th one. And then there's one more.
checking for allergies.
Very important, definitely something we want to do before we administer the drug. But when we're talking about drawing up the medication, we also want to do what with all of this information?
Make sure we have the right amount.
Absolutely.
Drug.
Absolutely. Let me rephrase. When we are delivering this patient to the hospital
Mhm.
and we've said we've done X, Y, and Z for this patient, what are we going to hand them?
Oh, documentation.
Yes, documentation. Any other questions?
I was just wondering, when I'm documenting, what all would I document when I give an injection or I'm drawing up medication?
Yeah, absolutely. So everything we just talked about, right?
Mhm.
You want to make sure that it's the right patient on your paperwork.
Okay.
You want to know where you gave it. So you said injection. So if we are doing an IM injection, if we did the shoulder, or if we did the lateral thigh,
Mhm.
or any other locations that are appropriate within the protocols,
Mhm.
we want to make sure that that's written, and if it's right side or left side. And then we
Mhm.
also want to put what time we gave that medication next to
Okay.
that, as well as what medication it was and the dose of it. So we want to have all of that right there on that documentation for the hospital so that there's no
Mhm.
question at all about what we did, where we did it,
Mhm.
and what time we did and how we did it. Does that
Okay,
make
yeah,
sense?
that totally makes sense.
Okay.
Yeah, I didn't realize I was forgetting one.
No, that's so okay.
Yeah, no, that really explains all of it, like in great detail. Thank you.
You're welcome. Any other questions?
I don't think I have any other questions.
Okay, sounds good.
Okay.
All right.
You know what, I was thinking, I actually have one more question. So when
Yeah.
I was drawing up medication, I was practicing.
Okay.
And I prepped everything correctly. I had all my needles and everything. And when I went to go drop the medication, it
Mhm.
almost like wouldn't come out. It was like I would pull it and it would just go back up.
Okay.
And I don't know how to fix that.
Yeah,
I don't know what to
absolutely.
do.
So when you put it together,
Mhm.
and you had the needle on, did you end up pulling any air back before you tried to draw anything? Like before you
No.
even put the vial on the
You know
needle?
what? I was thinking that I shouldn't be giving my patient air through the needle, so that's
Right.
why I didn't think I would need to pull any air in.
Okay.
But is that what would help?
Yeah.
Does
Do you
air go away?
want to see it again?
Yeah.
Okay. Let me get rid of the saline that I had drawn up earlier. Okay. Let me get the right needle. And do you remember what needle we used to draw up the medication?
It would be a filter needle, or
If you're using an ampule, which isn't really used a lot,
Mhm.
yes, but blunt tip is the one that we're
Okay.
going to be using, right? So we're going to do the palms together, the pinkies together, and then we're going to insert the needle.
Okay.
Is that what you did?
Yes.
Okay, so next time I challenge you to instead, whatever the dose is that you want,
Mhm.
pull back whatever that dose may be. Let's just say the 1 cc again for
Mhm.
this, right? So now you have air in there, and then do palms together, pinky together, and then insert in the vial.
Okay.
Now, when you flip it up and you push in, it should draw back a
Oh
little.
wow!
Yep.
I totally thought it would be giving the patient part of the air I just pulled in.
So you might have a little bit of air, but again, if you
Mhm.
just tap, right, and then you can draw back a little bit more if you need, but when you push that plunger up, that air goes away.
Okay, I didn't know that.
Yeah. So I challenge you to do that next time, and that might help a
Okay.
little bit.
And then I would switch the needle before giving it to the patient because that one's
Correct.
very blunt, right?
Correct.
Okay.
Yeah.
Okay, that makes a lot more sense.
Wonderful. Any other questions?
No, so I was thinking, how many times would I wipe the vial before do I wipe it once before I take the cap off? And then, how many times would I wipe it?
So imagine the pop top is right on here.
Mhm.
You can pop it, and then you can just wipe once with an alcohol swab. I wouldn't wipe multiple times because then
Okay.
you run the risk of introducing other things every time you wipe, if that makes sense.
Okay, that makes sense. I didn't know if it was sterile when it came off and that I would not really need to wipe.
It depends on your protocol.
Okay.
Some places say you don't have to, other places say at least once. But if you are going to wipe, just once is fine.
Okay.
Yeah.
And then I would just wipe the patient once, and then I would put it in.
And that'll be a different topic. We'll talk about that
Okay.
later.
Okay. yeah, I think that explains it really well.
Awesome. Okay, wonderful. All right.
Feel like
1503. Yay!